So we see cholera in almost the whole region where we are working. So it's in Zimbabwe, in Mozambique, in Malawi, and very recently started also in South Africa. I am Mounia, the regional medical responsible for MSF in Southern Africa. So I will start with Zimbabwe. The outbreak started in February 2023 in Mashonaland West province, and it spread quite quickly in the whole country. Now all the provinces of the country are affected by cholera. Because cholera is endemic in the region, the cases are rising slowly, but there are some spikes in some part of the country, namely in Harare, the capital city, where we are intervening and where we have a project, and also in Manicaland, which is the province bordering Mozambique. In South Africa, we had the first cases of cholera, suspected cholera at that time, that now are confirmed in Hammanskraal, which is in the north of in Gauteng province. For the moment, it's localized there, but we had already some cases in Free State and also in Limpopo. We don't know yet if these cases are related, but what we know is that there are already 20 deaths in Hammanskraal city, and at the difference of other setup or other countries, there is no immunity in the population. So the cholera is not endemic in the region. To Mozambique, we faced also a big outbreak, and it was following the cyclone Freddy. This is a big sort of a trigger of the outbreak in general is floods, heavy rain, or cyclones. So after the cyclone Freddy, there was a part of Mozambique, which is Quelimane, where all the infrastructure they have been destroyed. We had many floods because of the cyclone, and then there was a big outbreak where we did an intervention with case management, health promotion in the communities, and within 6 weeks the outbreak was controlled, and also thanks to the vaccination that was done by the Ministry of Health. MSF response in Zimbabwe is the location where we have our project. First in Mbare, which is in the high-density area in Harare, the capital city, and also in Beitbridge, is at the border with South Africa. In these two places, we are working with the Ministry of Health in terms of supporting in the community, but also case management, training in the hospital, and also we supported building CTU, which is the acronym for Cholera Treatment Unit. This is in Harare. We also did support in terms of WASH, water and sanitation and hygiene, in terms of putting chlorine, disinfection of water, distribution of buckets. What is the most important is the health promotion messages to the community. In Mozambique, it was much more kind of an emergency, so we supported at the hospital. We did case management by ourselves, also with the Ministry of Health, but we had our MSF had built very quickly a CTC, which is a cholera treatment center with 100 beds. This we run all the intervention in the centers. In South Africa, we are starting to work with the DOH, and it will be mainly in the community. We would like to focus on health promotion and WASH, water and sanitation and hygiene. So So if you have a population that has immunity, so somehow that there is the bacteria is a bit circulating in the community, we are going to act completely differently. So what is always very important is the health promotion messages in the community, how to and when, how always to wash the hand before eating, before preparing meal, before and after going to the toilets. All these elements are very important. But also to use safe water. So how to use safe water with the chlorine, with aqua taps, with all these elements. And then when the cholera is already in the community, then we can put what we call the oral rehydration point. Is some point where we have the oral rehydration solution that are prepared like this to avoid to be dehydrated. Because this is the main reason why the people get sick, is because they lose water.